Hi, this is Dr. Sai Praveen Haranath from Apollo Hospitals, Hyderabad. I'm going to let you know today about an important human organ, the lungs. The human lung is an amazing structure. When you stretch it out, it stretches out to the size of a tennis court. However, when people are exposed to toxic gases, air pollution, and tobacco smoke, they get affected and the lung size decreases. People end up with conditions like chronic obstructive pulmonary disease or COPD. On November the 17th, every year, the world celebrates World COPD Day. This is to highlight the importance of COPD as a major cause of mortality and morbidity. Over 300 million people around the world are affected by COPD, and over 30 million in India is according to some statistics. The treatment of COPD involves using medicines to relax the air tubes, try to prevent infections, and there are multiple other ways to diagnose COPD. COPD is not known by many people because in the early stages they may have no symptoms. However, if you do a test called spirometry, you can measure the lung capacity and you can also do a pulmonary function test. When you have COPD, people may complain of shortness of breath, difficulty in walking upstairs or even on level ground. They may be producing more mucus or sputum or phlegm when they cough. They may also have weakness, especially related to other medical conditions which are also triggered by the same toxin like tobacco. When you have COPD, you may have difficulty with speaking. You may have a tough time when you're trying to do your normal activities or exercise or even go about your daily routine. The treatment of COPD involves stopping the damage, and this involves tobacco cessation and stopping smoking as the number one thing that you can do. Many people in India actually are exposed to second-hand smoke just like anywhere else in the world. But in addition, when people use wood fire burning to cook, this is also a major cause, especially in women. I sometimes see women who are 50, 60 years old who never smoked, but when you look at their lungs and get their history, they sound like they have smoker's lungs. Sometimes it's because of second-hand tobacco exposure from other family members, but oftentimes it's due to damage in the lungs because of the burning of the wood which they use for cooking. Especially if you have an enclosed setting, you can have air pollution, indoor air pollution trigger the damage in the lungs. The treatment involves diagnosis, of course, and then you might need medicines like inhalers to relax the air tubes, medicines to cut the inflammation inside the air tubes, and when they have a flare-up of the COPD, you may need antibiotics. Fortunately, there are some ways to manage even severe cases of COPD. These, of course, involve prevention using vaccinations for influenza, pneumonia, and in fact, even now COVID. And in the COVID crisis, we have seen that patients with COPD do get affected. And if your lungs are already weak, there's a chance they'll get worse even more if you have a major infection. This year, the whole theme is to never underestimate the fact that you need lungs. And this year's theme for the World COPD Day is healthy lungs, never more important. So it's very important for us to recognize that healthy lungs are extremely critical for the normal maintenance of our lifestyle as well as our activities and exercise. The lungs usually bring oxygen in and they move carbon dioxide out. When people have COPD, they sometimes retain the carbon dioxide in the blood and they may get drowsy, they may have high blood pressure, and there is often a sensation that they have difficulty with breathing related to the retention of the carbon dioxide. The other issue that we should really focus on is when people already have COPD and have a flare-up of their disease, it's important to try our best to avoid triggers which may make things worse, and these include infections, tobacco smoke, air pollution, dust. In addition, you may also have to treat with antibiotics as well as sometimes they even need steroids. The last issue that I want to focus on is that along with tobacco cessation, when people have extreme COPD, they may need lung rehabilitation. And lung rehabilitation is a set of exercises to strengthen the body and strengthen the lungs. Very rarely when patients with COPD are at their end stage, they may even need a lung transplantation. Fortunately, all of these modalities of treatment are available in India. They're available at Apollo hospitals, and we do have a system of managing the patient with COPD, and we're also looking at using artificial intelligence to promote the concept of diagnosing COPD early. So for this World COPD Day, let's look out for our neighbors and friends who might have had exposure to tobacco, who don't know that they have COPD. Let's have them get it diagnosed so that their treatment can begin early. Thank you.